Go.
Hello, I'm going to be showing how to change a central line dressing. First thing I'm going to do is I'm going to wash my hands, then I'm going to check the physician's order, then I'm going to identify the patient, then explain the procedure to the patient, introduce myself to the patient, gather equipment, and provide for privacy. Okay, now the first thing that I'm going to do is I'm going to let's open this up. My kit, put my sterile gloves to the side. I'm going to put my mask on, and if there's one for the patient, you can also put one on the patient, and make sure the patient's head is turned away for the procedure. I'm going to put my gloves on. We're going to go over to the center line and we're going to examine it and make sure there's no redness or anything. We're going to take it off slowly. We'll hold down the tubing so we don't pull anything too hard. Okay. Then we could throw the dressing out. Now if there was any redness or swelling, I would go ahead and document that. This one looks good. So now I'm going to take off my gloves. And now this is the sterile part of it, so I'm going to use my sterile gloves. I would also make sure that my hands were clean with alcohol before I would put these on. Okay. I'm going to use this cleaning stick in the solution, and I would squeeze this to make sure it comes out. And then I'm going to rub the area with this, and I'm going to do it for about 30 seconds. Make sure I get everywhere. And I also go a little bit up the tubing, make sure it stays clean. And then once I'm done, I would let this dry for 30 seconds. Okay, and I'm going to get my Tegaderm. I'm going to peel off the backing. I want to make sure the opening is against the tubing, and I'm going to set it down like this. Like that. sure that there's no air bubbles. Okay. And then I would take off my sterile gloves, pull them out, and I would go ahead and write my initials on here and the date and the time that I changed it, and I would stick it on, and then I would document what I just did, and I would be done.